Welcome to Down in the Bumps, a perinatal mental health podcast that shares stories of women and families who have experienced perinatal mental health problems. My name is Laura. I'm your host and I'm a doctor training in psychiatry. At the end of each episode, I'll share some learning about perinatal mental health related to the story we've heard. Please note that what is discussed in the podcast should not be taken as medical advice, and you should discuss your own medical care with your GP. This time I'm speaking with Charlotte, who's mum to baby Cooper. She tells her story of experiencing obsessional thoughts and compulsive behaviours, which were at their worst during the later stages of her pregnancy. She has lots of wise words to share, and I think her story really inspires hope. We do talk about topics which might be difficult to listen to, so if you're finding them triggering, consider stepping away, and maybe you can join us at another time. Okay, so Charlotte, thank you so much for coming to talk to me today. I understand that you're actually a peer support worker. Can you tell me what a peer support worker is?
Yeah, I can try, yeah. So basically, I introduced myself to other women under our service as an ex-service user. So basically, someone with lived experience, someone who has been sat where they are at that moment in time. Just basically, not to call myself a beacon of hope, but essentially someone who's gone through a mental health struggle and come out the other end, almost like to show you that it's possible to feel better again, because in that moment you don't feel like you ever will, I don't think. So yeah, someone with lived experience.
Yeah, I quite like beacon of hope, actually.
Yeah.
I think you should lead with that.
Okay.
So Charlotte, you mentioned that you've got lived experience of perinatal mental health problems.
Mm-hmm.
How was your mental health before you became pregnant?
So I've always sort of like for the past 12 or so years struggled with anxiety and depression, sort of low level. I've been on like fluoxetine 20 milligrams on and off really for the last 12 years. But yeah, I think prior to getting pregnant, I felt good. I felt I was on the meds and I just felt totally stable. Like it wasn't really a concern. It wasn't really anything that I kind of thought, oh God, I wonder if it's going to worsen when I get pregnant. It just wasn't really a consideration.
Mm-hmm. Yeah. So lots of women worry about the effects that medication could have on their pregnancy. And I just wondered if that was something that you thought about and maybe had a discussion with perhaps your GP.
Yeah. Yes, so I say it wasn't a consideration, but I guess it was in the sense of I was under the impression that I was going to have to come off medication anyway. So it was like a 3-minute phone call with my GP. It wasn't my usual GP. With my usual GP, we have a bit of a rapport and he kind of knows me and my history. But this GP wasn't the person who I usually see. And it was just sort of, because I'd already come to the conclusion from like Google and just other people that I would have to come off it. So I'd sort of started weaning myself off it already. And then after the conversation with the GP, he just sort of confirmed it. Yeah, you can't be on your medication whilst you're pregnant. It wasn't really a conversation, but I didn't really think that it was going to be. So I didn't push for it to be. Mm-hmm. It wasn't like, oh, well, please, can I stay on my medication? I didn't think it would be a problem. So I was just like, yeah, that's not a problem. I've already started weaning myself off it anyway. And he just kind of said, yeah, continue to do that. Obviously, advised me to not just stop it suddenly. And yeah, that was it. And that was just it. I just sort of slowly came off it and didn't give it another thought, really.
Mm-hmm. So it sounds like it wasn't a particularly balanced conversation. It was like you went into it thinking this is what we're going to do. The GP didn't really add any other perspective.
No, it wasn't like, oh, well, I can see you've been on the medication for 11 years. I can see that, it is, I know 20 milligrams is quite a small dose, but it is like for me, it was a maintenance dose. And there wasn't that sort of like acknowledgement that there was long-term issues there, and how coming off it would affect me. I sort of heard like a typing in the background and like, let me just have a look. And then it was sort of like, yeah, you're not supposed to take the medication while you're pregnant. And like I said, I was just like, okay, because I thought that, oh, well, that's the safest thing for baby. Obviously, you do what you think's best for baby. You don't necessarily think about your health being linked to your baby's health at that point. So yeah, off it I came.
And then what happened next?
Well, it was like so I got pregnant at the start of the pandemic, like April 2020. Obviously, like everyone will know, the first trimester is gross. It's not enjoyable, regardless of whether or not you've got mental health issues. So, but it was quite nice weather. It was sunny. It was lockdown. I had no idea that it was going to be a long-term thing. So I was just kind of, I was on furlough from my previous job, and it was just like lying in bed all day feeling sick and watching my favourite TV shows. And I felt, even though physically I felt rubbish, mentally I felt well rested, I guess, and fine. And like I said, it was at the start, so no one really knew how long this pandemic was going to be going on for. Second trimester again, everyone, I know you're supposed to be like glowing in your second trimester, aren't you? I didn't particularly have that experience, but it was fine. It was, everything was opening up again. It was in the summer. So there was a little bit of anxiety and trepidation about going out with COVID. And obviously, like, the vaccine wasn't a thing at that point. And again, COVID was still relatively new. So in terms of what impact that would have on being pregnant, I was very cautious and careful. So I didn't go out that much, even though everything reopened. I probably went out for tea once, and my husband did the weekly shop. And other than him and my mum and like immediate family, I didn't really see anybody or do anything. So I guess that was probably having an impact on me at the time, even though I didn't really realise it. And then third trimester, winter, lockdown hit again. COVID was like, the cases were ramping up, and it was like, what am I going to do about giving birth if my husband's got COVID? I'm not going to have anybody. I'm not going to have a birthing partner. My mum already couldn't be there, which was something that I'd already always envisioned. And it was just, isolation was getting to me, and no sort of sign of things easing. And it's darker nights and shorter days, and you just feel like the repetition. Like I said, I'd started working again at that point, but again, because I was pregnant, I hadn't gone back into the office. I was literally in the house all day, every day. And it was probably about 6 weeks before I had my baby. I was reading something. It was just honestly nothingness, looking back at it now, but at the time, I read something sort of like particularly wasn't pleasant what I read. It was just in a book. And looking back, I guess it could have been anything. It could have been a news story. It could have been, something on the telly. It could have been, a murder documentary, whatever. I read something and it just like caused this reaction inside it was in relation to children. So it was like, obviously I'm there heavily pregnant, about to have a child. It was like, oh my God, that is like the most horrific thing ever. I need to get that out of my brain immediately. I'm about to be a mother. And then because I wanted so sort of like passionately to just never think of it ever again, it meant that I was like flooded by this thought. I mean, it started off with, just that particular day, and then it would bleed into the night, so I wouldn't sleep. And then it would, it wouldn't just be that thought, it would be other horrible thoughts in relation to loads of different things. So not just the baby that I was about to have, but, my family, or a lot of what ifs, I suppose. So a lot of like, what if I have this baby and there's no bond, or what if I have my baby and have a horrible thought about him immediately, and that destroys my relationship with him forever. And there was just honestly, it became, I would assign a thought to an action. So even just something super simple like making a cup of tea, and I'd have like a horrific thought, and then it'd be like, oh my God, am I going to have this horrific thought every single time I make a cup of tea? And then I would, because I didn't want to. Yeah. Or looking outside and seeing a tree, or just really simple things where it became every second of every day I was thinking horrible thoughts all day, every day. And there was no relief from sleep, because I didn't sleep either. And so obviously now I know that that's OCD. But at the time, you know, I was very much of the impression that OCD was like being clean and tidy and organised and liking things in a very specific way, and which it can be, but it has to be like super debilitating, which, yeah. So anyway, sorry, that was a very, very long answer to your question. In summary, my pregnancy started off really well, and towards the end, my mental health deteriorated. But I do think it was a perfect storm of like loads of things, coming off the medication, COVID, having a predisposition to OCD anyway, like looking back. But yeah, that was kind of me at my absolute worst, was just flooded with intrusions 24 hours a day. Just everything, it was just unbearable. Being scared of your own brain is like the most terrifying thing. There's no relief.
Yeah, it sounds incredibly distressing.
Yeah.
So how did you come into contact with perinatal mental health services?
I was just super honest about it up front. I think that it would have been a completely different conversation had I already had my baby at that point. But I think because my baby was still in my stomach, I knew that, you know, there wasn't that core fear of, oh my God, they're going to take my baby away from me because they think that these thoughts are things that I align with.
Yeah.
I was protected by that. I was already under IAPT just for sort of like general anxiety.
Yeah.
So I disclosed to him. I told him I was having some pretty awful thoughts, but I also mentioned it to my midwife, and they both referred me to the specialist perinatal mental health team, which is who I work for now.
Mm-hmm. Yeah, and just for anybody listening, IAPT and Minds Matter are sort of primary care psychology service. So it was via psychology that this started to come out. Yeah.
Yeah. But you can self-refer to them, which is what to Minds Matter and IAPT, which is what I did originally. So yeah, that was kind of my way in.
Mm-hmm. And what was your first contact like with the perinatal mental health service?
So I had my mental health nurse, who is amazing. I love her. I work with her now. And she came to my house. I was seen really quickly. I know now that, obviously now that I work for the team, that I was seen as an urgent.
Mm-hmm.
Because I was quite distressed. So I was seen really quickly. She came to my house. Thankfully, I had my mum there, so I felt sort of like protected. And she did answer quite a lot of it for me. Like I said, I was really traumatized. It was sort of like I couldn't really vocalize any of the things that I was terrified. Like I said, your core fear is that your baby's going to be taken away from you, or you're going to be assumed to be an unfit mother. So I think, yeah, she was lovely. She was so nice, and she just did like an assessment, basically an initial assessment to see if I would be taken under the service, which obviously I was. But yeah, she was lovely. She was warm. She obviously normalized my experience because it's so common. You think at that moment in time you're the only person in the world that's ever had these thoughts, but she normalized it. Bit of psychoeducation on what I was experiencing, and then it was just sort of like, right, I knew at that point I was under the right service. I knew that I was going to get the help that I needed, and we just went from there, really.
So yeah, I was going to ask, actually, you said that you've obviously come to know that what you had was OCD.
Yeah.
Was it really that first appointment with her then that you started to realise that it was OCD, or did you start to suspect before then?
Yeah, I had started to suspect before then, but only through Googling.
Yeah.
I know. Because one of my main compulsions is like reassurance seeking. So obviously the second I had a thought, it was like getting on Google to see if there were other people in the world who felt like that. But it doesn't matter how many times you Google it and how many times you see that people have thought the same things that you think. There's no rationalizing it when you're in that headspace. So to hear it from like a healthcare professional is different from just reading it on Google, I suppose.
Yeah.
So it just sort of hearing it from her validated what I already suspected at that point anyway.
And then you later met with a consultant psychiatrist on the team. And what was that meeting like?
Yeah, he was lovely. He came to my house. I was on my own for that, actually. Although I was given the option as to whether or not I wanted my mental health nurse there as well. But because I was so ashamed of everything that I was sort of like disclosing, I wanted to keep the circle as small as I possibly could. But he was lovely. He was very medical, there was a lot of jargon, and I had to answer quite a lot of the same questions that I answered to my mental health nurse, which I suppose you don't really want to be doing that. But yeah, it was quite medical. And I knew after that I was going to get like the medicine that I needed. So it was like, oh, amazing. I'm under a doctor here, because I'm sure that people listening will have the same experience as me, as when you're trying to get in touch with your GP. It isn't always the easiest thing, especially during COVID, with everything having been changed to over the phone. So yeah, it was nice to know that I was kind of sitting directly underneath him.
Yeah, absolutely. And I know that although you got medication prescribed from the consultant, there was a bit of sort of going to and fro about your diagnosis.
Yeah. I don't know if I've got a formal diagnosis. I don't think that I do. I think there is a little bit of trepidation about giving a formal diagnosis, because it suggests that you are in a constant state of that one particular thing. My psychiatrist sort of said, well, I don't really want to put a label on it, because sometimes you're depressed and sometimes you're more anxious and sometimes, you are showing symptoms of OCD. And it wasn't really one thing. But for me, having that label of OCD would have just been like, it would have just reaffirmed it. It's the ultimate compulsion, like it's the ultimate reassurance that you have OCD. But I do think that it's hard as well to potentially diagnose in the perinatal period, because sometimes it can just be specifically related to the perinatal period, and you might not have had any sort of like OCD-like symptoms before that, and you might not have them ever again. For me particularly, now I know I've always had it and I will always have it. But yeah, having a diagnosis would be life-changing. It would be proof. It'd be the ultimate proof that I'm not a monster. That I'm not the things that I think I think. Do you know what I mean? It's that sort of, yeah. You are ill. You're not a horrible person.
Yeah, it's quite interesting to think about, because I think some people wouldn't want to be labelled and wouldn't like a diagnosis, but then other people would.
Yeah, it's so individual to that person, I think. Yeah, I think that some people don't want that. They'd rather not know. They think it can be stigmatizing, I suppose. And I think there were probably moments where I was like, oh, I don't want to have it. You don't want to have OCD. Yeah. So why would I want someone to tell me that I've got OCD? Like, it isn't something that I want. But at the same time, it does validate your experience, and sort of like, for me, it was important. For other people, potentially not so much.
You talked there about medication that you prescribed. What treatment and support were you offered by mental health services, apart from specifically the medication?
So, apart from the medication, I had an occupational therapist who I saw weekly. Obviously, I had my mental health nurse. I had mental health midwife, and sort of like a special birth care plan, which was really helpful, especially because I had special requirements in terms of my partner being with me at all times. And these are the signs to look for if she deteriorates, which felt really nice, safe to have that in place. I had a nursery nurse involved in my care as well. Obviously, there was a lot of concern from me that maybe this is going to impact my bond with my baby, and maybe there'll be sort of like a disconnect because of the thoughts. And also a lot of like self-loathing. So I'm not a very good mum to be having these thoughts. I'm not a good person. My baby doesn't like me. My baby deserves better than me. And my nursery nurse sort of, she helped with identifying baby cues, and sort of like just really helps you connect and find that bond with your baby, which I was really lucky to have in the first place. Like, that wasn't a concern. Actually, after I had him, I realised that the love that I had for him would far outweigh any thought that I could ever have. But I know for a lot of people, that is something that, I mean, don't get me wrong, it definitely wasn't a lying my baby on me and falling in love at first sight. It was like, oh my God, is this alien that you've just placed on me? I hate that narrative. I really hate it. I know it is like that for some people, but for me it wasn't. And I would love to just dispel that idea of just falling in love with your baby the second that you see them, because I don't think that's always true. I was very lucky to be able to get psychological input privately. There was just a little bit of a wait list. I almost felt like there was a deadline, like having my baby, because it was 6 weeks before I had my baby. It was like, right, I need to be better before my baby's born. And then as soon as my baby was born, it was like, I need to be better as soon as possible so that I can start enjoying this experience. So I was very impatient. But yeah, and then obviously medication, which is massive. So yeah.
And I know, Charlotte, it was really important to you to learn about your condition and about its treatment. And I know that you did quite a lot of reading and had a lot of conversations with people in the perinatal mental health team who were supporting you. I just wondered if you could talk a little bit more about that.
Yeah, it was like the normalization of it, and also understanding that you being well means your baby as well. Like recognizing that we were one of the same was like huge, because there was a lot of, at the beginning when I was given the medication, like, is this something that I want to do? Do I want to take this medication and put my baby at risk? You know, I come 34 weeks without taking it. Can I survive these next 6 without having that? To kind of know the intricacies of what the medication is going to do. And also my womb wasn't a particularly habitable place for my baby at that point in time, because I was just so anxious all the time. Like must have been horrific for him. And to be able to take that medication and not have that sort of like bodily reaction to like the anxiety, to be able to eat as well. Like I wasn't eating. I was really quite poorly. And I think weighing it up, and it's not really a choice between your mental health and your baby's health. It's, your health is your baby's health, and having that discussion with the relevant people was like massive. I think that definitely changed my attitude. And obviously I did start taking medication, but I needed that sort of conversation to feel comfortable in doing it. And in hindsight, I suppose that's probably the conversation I should have had with my GP at the beginning. But hey ho.
Yeah, but that's a really important message, isn't it? Yeah, I like that. I think that's really important to bring out.
Yeah.
So, just sort of thinking about your experience.
Yeah.
Is there anything else that you would like doctors and other healthcare professionals to know?
I just think that it's super important to take into account a person's sort of history. I just think that it needs to be more of an open conversation in that very first initial sort of, I'm pregnant, what do I do about this medication? It needs to be sort of like, well, how do you feel about that? How do you feel like you would be able to cope mentally with coming off your medication? Maybe sort of like checking in 3 months to see how someone is getting on further down the line, because obviously things change. And, it would have potentially been quite nice to have had that regular contact with my GP throughout my pregnancy. And I think also like having that dialogue with your GP to know that you can talk to them about it before you're even pregnant. So I think like preconception advice is massive, and that's something that our service offers. It's for women with moderate to severe mental health problems and people who've obviously been under the service before. But I know that if I was to go and get pregnant again, I'd be able to have a one-off session with a psychiatrist to discuss the medication that I'm taking, how it would impact pregnancy, the pros and cons, because there are cons, but it's just about weighing that up and it just being more of a just an open and honest conversation. As well, working for the service now, a lot of the women who come, their story will often start out with, they were on this medication and then they were advised to come off it at the beginning of pregnancy, and it's just so preventable. And I'm not saying that obviously like staying on medication is necessarily the right thing for all women, but we need to have all of the information before we make that decision.
Is there anything you'd like pregnant women or new mums who might be struggling with their mental health to know?
That it gets better, because I think that when you're in it, when you're really, really, really in it, and you feel like you've never felt good and you'll never feel good again, you can't remember what it's like to feel good, but you just feel like you've just constantly been in this state of awfulness, that it does get better. And it isn't forever, and does take time and it takes work, and that can be hard if you've not got the motivation. I think that you've nothing to be ashamed of, and there shouldn't be any fear about women coming forward to talk about how they feel antenatally or postnatally. I know that there is that core fear of like being super terrified that your baby is going to be taken from you, and I think that is a massive obstacle in women seeking help, and I think that needs to be demolished, because that's not what these people are. These people are not here to take your baby from you. They're here to help you be the best version of yourself, to stay with your baby. And I think that that can be, especially if you've not been involved with mental health services before, that can be really terrifying. So I suppose just be open, honest, dedicated to the process, and it will get better.
I hope you don't mind me just mentioning, Charlotte, what you said last time we spoke, which I just thought was a really lovely thing you said. So I wrote it down.
Okay. Oh gosh.
And you said, it's okay to grieve the experience you thought you were going to have.
Oh, totally. Yeah. Did I not say that this time?
No.
Yeah, I think that a lot of that process in getting better is sort of like acknowledging that, you know, it is so not fair that we weren't able to get what we envisioned, you know, especially as first-time mothers. I know that it's the same for all mothers, but like first-time mothers, you have this idea of how your pregnancy is going to go and your birth is going to go, and you know, the first few months. And my experience was just completely the total opposite to what I wanted. And a lot of it was sort of like just feeling really sad that was the case, and that it wasn't, you know, I was never going to get that back. I'm never going to have my first pregnancy again. It's never going to be something that I'll be able to replicate. And there isn't anything that I can do to go back and change that. It is mourning the experience that you thought you were going to have. And that does take time. I wouldn't say that it's even something now, you know, I look back at pictures of that time, you know, first 1 to 3 months, and think, oh my God, I couldn't even fill out like the baby book. You just think, oh, it's such a shame that I couldn't fully enjoy that part of being a new mum. And it is, yeah, it's and that might look differently for other women, you know. Some women who envision that they would be able to breastfeed, or other women who have envisioned that they would have a vaginal birth and water birth, and, you know, sort of like nice calm birth with no intervention. And that obviously isn't the case for a lot of women. And I think that is something that a lot of women have to take time to mourn, or whether or not you didn't have that immediate bond with your baby and it did take time to build up, that's something to mourn as well. I think there's just this very high expectation of what our experiences should be, and yeah, it doesn't always go to plan, and it is okay to feel sad about that and mourn that experience.
Yeah, it's really wise words.
Something that I have to tell myself daily. So yeah, it's okay to feel sad about it. Like let yourself feel. You don't have to feel happy all the time. It's possible to feel two things at once, and you can feel, you know, grateful that I have a happy and healthy baby, and I am a mother, and I've been able to, you know, get pregnant. But also, I'm allowed to feel sad that it didn't go the way that I wanted it to go.
Well, you've done so well, Charlotte, to come through it.
Oh, thank you.
And how's the relationship between you and baby Cooper now?
Oh, good. Yeah, he's good. He's 1 and a bit now. And don't get me wrong, I still have bad days, and still have OCD, and I still have intrusions and things that I don't want to think about, because I don't want to think about them. So obviously my brain is like, right, well, I know you don't want to think about this, so there you go. Yeah. But I've learned to deal with it a lot better, and it is something that I have to live with daily, but I'm all right with it. I'm at peace with it now. So yeah, a lot better. And my baby's good. He's always been good. He's been good from the get-go. A little horror, but he's good.
Oh, brilliant. Well, thank you so much, Charlotte, for sharing your story.
Oh, thank you for having me. I hope that it will be helpful. Who knows? I'm not sure if I've helped, but hopefully I have.
No, I'm sure there will be so many women and families and healthcare professionals that will take so much from what you've talked about today. So thank you.
No worries. Thank you for having me.
Isn't Charlotte great? I hope you enjoyed listening to her and learning from her as much as I did. Now it's time for the medical bit. I'm going to talk about perinatal obsessive compulsive disorder, or OCD. I may use terms that are more familiar to healthcare professionals. And just a reminder, the content of this episode should not be taken as medical advice, and you should discuss your own health with your GP or your mental health team. So the prevalence of OCD in the general population is around 1 in 100 people. There is a greater prevalence of OCD during the antenatal period, affecting 2 or 3 in 100 women, and affecting up to 9 in 100 women in the postnatal period. Symptoms of OCD include recurrent, intrusive, distressing thoughts which the person tries to resist, those are the obsessions, and also compulsive behaviours, which are generally related to the obsessional thought. The function of these behaviours may be to try to neutralise the thought. Now, we all have intrusive thoughts that pop into our heads from time to time. And in people without OCD, those thoughts are easily dismissed. In people with OCD, though, the thoughts return and they can become really distressing. People with OCD might then assign meaning to the thoughts, such as when we heard Charlotte talk about how she was experiencing recurrent and distressing thoughts, which she thought meant that she was a horrible person. Now, sometimes we might hear people describing themselves offhand as a little bit OCD to explain their preference for having a clean and tidy environment. People with OCD can have obsessions and compulsions related to cleanliness, but these symptoms cause distress rather than satisfaction. We should therefore be mindful that such throwaway comments can lead to people with OCD feeling misunderstood, and it might prevent people who are struggling from seeking help. So obsessional thoughts seen in perinatal OCD may include worries that the baby might stop breathing, that the mum may harm the baby, that the baby has a serious illness, sexual thoughts about the baby, or that the baby might choke on something. And evidence shows that in women diagnosed with OCD alone, actual harm to the baby has not been reported. Examples of compulsive behaviours include washing bottles repeatedly, avoiding changing the baby's nappy, or checking the baby's breathing throughout the night. Sometimes there can be less obvious compulsions, such as avoidance behaviours. This might include mums avoiding anything that they perceive may contaminate their baby. Other less obvious compulsions include seeking repeated reassurance from friends or family or the internet. The treatment of perinatal OCD consists of a talking therapy called cognitive behavioural therapy, or CBT, with exposure and response prevention, or ERP. ERP is when the person will be guided by their therapist to confront their obsessions and they learn how to resist the urge to carry out their compulsions. In addition to talking therapy, people may be treated with medication. SSRIs, or selective serotonin reuptake inhibitors, are the class of antidepressants which are recommended as first line for the treatment of obsessive compulsive disorder. We heard Charlotte mention fluoxetine, which is an SSRI. Women who have developed perinatal OCD in their first pregnancy are more likely to experience it again in their second pregnancy. For many women, with the right treatment, they can learn how to manage their condition and do recover from OCD. For further information about the topics discussed today, you can go to the Royal College of Psychiatry website. There's also a charity called Maternal OCD, and there's some excellent resources on its website. I've also been recommended a book called Everyday Mindfulness for OCD by Shala Nicely and John Hershfield, and that has some good practical advice. At Lancashire and South Cumbria NHS Foundation Trust, we are currently running a Drop the Jargon campaign, which encourages staff to speak to patients and carers in an everyday way, which is easy to understand. The Trust do offer preconception counselling for women with moderate to severe mental illness. This can be accessed by talking to your GP if you're in the local area, or if you're a healthcare professional, by referral to the Community Perinatal Mental Health Team. Thanks again for listening.